Thank you, Madam Chair, and thank you for this hearing. I just want to say at the outset, and yes, this is bipartisan. I got my flu vaccine as well. We are not trying to politicize. The problem is that the President of the United States has politicized this vaccine coming just weeks before an election, and we owe it to the American people to explain the process and the system and the transparency in the hopes that one of these multiple vaccine candidates will be proven safe and effective. But that will be only half the battle. Once we've had an approved vaccine, we still face the formidable challenge of distributing hundreds of millions of doses around the country. This will be an unprecedented effort, and we need to start preparations right now. Dr. Kam, what are some of the essential lessons learned from past vaccination programs, such as H1N1 pandemic, regarding the mass distribution of a novel vaccine?
Thank you, Congresswoman Kuster. As I had stated in my testimony, I think it starts with appropriate messaging. So under promise, over deliver. Make sure we have excellent planning at all levels, local, national, state level, tribal, and territorial level. Make sure we have prioritization. We know there's not going to be enough vaccine the moment it's released, and people need to understand why if there's 100 people in a hospital, only 2 are getting it as opposed to the other 98. So that needs to be clear up front, and there needs to be, and part of the planning needs to deal with the logistics. This is going to be logistically extremely difficult. Unlike the H1N1 pandemic in 2009, in the end, there was only a need for 1 dose. In this case, you need 2 doses of the exact same vaccine, 21 to 28 days apart, which will be problematic. There's complex requirements for storing these vaccines, and then depending on what the size of the orders are, those may need to be split up and sent to various places in rural areas. And we talk about mass vaccination, but we need to be careful about what the word mass means, because during a pandemic, you don't want hundreds of people all gathered together, because that's a good way to infect them as opposed to protect them, and we'd like to keep those 2 pieces apart, the infection and the protection piece. So there's going to be significant challenges throughout the system. And then I didn't even get into the data systems, which there's
that's what I was going to ask you further about. One of the challenges with the vaccination program on this scale is the data systems to track the distribution and schedule the immunizations, especially if they need 2 separate doses. How important is this aspect, and what should Congress be doing to ensure we have good data on a vaccination program?
So how do we strengthen the 4 or 5 systems that are going to have to work together in terms of vaccine tracking, immunization registries within the state, the vaccine adverse event systems? So there's 3 of, actually there's another system, VAMS, which is an overarching vaccine system. So how do you make sure those are working, are robust, are interoperable, and will give you the data in real time that you will need to ensure that not just where's the vaccine being distributed, but it's actually getting into people's arms and what the side effects are. And that's going to be critical, going back to Dr. Helene Gale and others' comments about equity, to make sure that as the vaccine's getting out, that we are being equitable in the distribution. And that's only going to be determined by data.
And Dr. Offit, is our existing health infrastructure adequate to meet the storage and transportation needs for national and equitable distribution, including rural communities, communities of color that have been disproportionately hit by the COVID-19 pandemic? And then distributing a global vaccine will require extensive air travel via cargo flights. Do we have the workforce and capacity to achieve this logistical feat?
Well, I think the one thing in this that does worry me is the requirement, at least for one of the messenger RNA vaccines, the mRNA vaccines, to be shipped and stored at -70 to -80 degrees centigrade. Which will require then at least dry ice constantly being maintained. And when they're doing studies now, where I'm sure that the company has been very good about making sure that the sites are maintaining that virus as it should be maintained with the vaccine, when it gets out into the real world, it's hard. There is no historical precedent for us maintaining vaccines on dry ice in the United States. That's never happened. We've always shipped and stored it at most at freezer temperatures, not -70 or -80. So I do worry about that. I think that's going to be an enormous challenge.
Thank you very much. My time is up, and Madam Chair, I yield back.